Over the past 2 decades, average life expectancy across the Asia-Pacific region has increased by almost 5 years. It's now just over 73, having been well below 70 years of age just 20 years ago. One common thread as to why is how emerging technologies are impacting healthcare in this part of the world. Dr. Stephanie Allen is partner and Deloitte global healthcare leader, and she joins me now. Stephanie, thanks for joining us. A lot has happened in just a couple of decades. What have been the primary drivers behind the significant shift in life expectancy?
Well, when you look at life expectancy, technology has certainly played a role, but so have also the social determinants of health. And that means access to clean water, housing, employment, air quality, nutritious food, etc. And obviously that has also increased in the region, leading to greater life expectancy. What we're now seeing, though, is that a lot of the innovation that's coming through that is really bringing life expectancy and actually good years to life is actually being enabled through technology.
Well, the work that you did on the extensive Future of Life Sciences and Healthcare in Asia-Pacific report was a very deep dive indeed. What were the key outcomes there?
So we looked at a number of kind of big changes that were taking place in healthcare. And I guess the first thing that came through was that typically we don't really have healthcare systems. We have sickness systems. So systems that deal with people when they're unwell or they've got some level of chronic disease, or when they've been involved in some kind of catastrophic event like a car accident. One of the major shifts that we're seeing, particularly in this region, is a focus on wellness, both physical and mental wellness and well-being. And so actually for the first time ever, moving healthcare to focus on promoting and supporting our health rather than just dealing with people when they're sick. And that's a fundamental change that is absolutely taking hold across this region.
Well, as I mentioned, we've seen that life expectancy has increased by almost 5 years over the past couple of decades. So what do you think is going to happen in 2050? Will we continue to live longer?
Interestingly, we've just released a report from Deloitte Access Economics, and it would actually suggest not. So it would suggest that actually some of the children born today in this region are likely to die 5 years earlier than their parents. And that's because we're starting to see a deterioration in some of those social determinants of health. And one of those, of course, is climate change and air quality, pollution, and changes to our environment in this region. We're also starting to see through COVID, and I think this is actually a silver lining, that the disparity between people who live long and healthy lives and those that don't have access to services and don't is increasing. And so those vulnerable groups, whether they are indigenous populations or drug and alcohol dependent or simply just rural and remote communities, don't have the same life expectancy that we see in those metropolitan areas. And as I say, one of the silver linings of COVID is that it really shone a spotlight onto that. And now what we're starting to see is public health systems across the world really starting to address that gap. So there's something about life expectancy, but there's also something about making sure everybody gets equal access to a good, long quality of life.
What about blockchain technology? How will that benefit consumers and health providers alike?
Well, that's a really interesting one. So again, blockchain will be at the forefront and a pioneer in some of the big step changes that we'll see in this region. What we know from healthcare is that there is a significant amount of transactions and payments that happen every day. Even if you look here in Australia and you look at our Medicare reimbursement levels, there is a number of payment mechanisms. What blockchain enables us to do is to do that in a very secure and real-time way. And why this is so transformational is because a lot of new players are coming into healthcare. So as we move from a sickness system to a well-being system, we're starting to see retail companies come into healthcare, transport companies coming into healthcare, nutrition companies, and certainly consumer spend in healthcare. And so blockchain will enable us to bring all of that together in a secure way around a single digital identity and for enable those transactions to take place in a much more complex marketplace that enables the consumer to choose the services that they want. So I'm really excited about blockchain. I think it is going to absolutely transform healthcare in this region.
Well, let's talk about medical tourism, because that was very popular across Asia Pacific before the pandemic. Trips to Thailand or Malaysia, for example, for certain procedures that were less expensive. Is that likely to come into play again going forward?
Yes, and I think also extend. So, again, one of the things that we've learned through COVID is we shouldn't just be restricted to the healthcare within our own countries. So, as we've moved to virtual healthcare delivery, both in terms of diagnosis and treatment, we can actually access that from anywhere in the world. So, you and I could go and get a second opinion from the Mayo Clinic tomorrow for a condition that our Australian GP has told us we may or may not have. And so when I think about medical tourism, of course, medical tourism is going to continue, but rather than it just being the cosmetic procedures or even the elective procedures, I think you'll start seeing a global marketplace of all healthcare services. Again, I would be really excited in this region that we have an incredible history of very high quality medical tourism, and that will only increase.